I want to do a little video on capacity. Basically, how do bodies adapt to load? And when do they heal? When do they strengthen? And some considerations here. Doing this on Canvas whiteboard feature. So I threw some words up there, and now we can dance back and forth through here. So the first I want to talk about is bicep curls. And so if we want to, say you want to be able to bicep curl 50 pounds. And right now all you can do is 20 pounds. If you try 50 pounds, there's a chance that you could hurt yourself. If you're trying to just do the concentric motion, that's going to be pretty difficult. Maybe you don't hurt yourself, but if you get it dropped in your hand and it drops really fast, there's a higher chance you could hurt yourself because you're not strong enough for it. And what is the strength that is needed? Primarily the muscle and the tendon, right? Those are the physical structures that we're loading that need the capacity to be able to do that. And so if you could bicep curl 20 pounds and you wanted to get to 50 pounds, what you're going to be doing is you're going to be doing a strength training, typical strength and conditioning routine to be able to build up to where you can do that. You may do, right under 20 pounds, maybe 18 pounds and do a few of them, rest, do a few more. And then after that, you rest a few days and then you go back at it again. Now let's look at running. A couple different aspects of running. Let's think about if we wanted to go from couch to marathon. So you're not a runner, you haven't done running, and you want to get to a marathon. Running is not bad for us. Running is safe. Running is healthy. Actually, people who are runners, when they're older, they have less painful osteoarthritis. So the changes in the joint look pretty similar as people are older, but how much pain they have with osteoarthritis is actually lower in people that have been runners. So yes, it's a safe activity, but if you were to say, I've never been running, I'm going to go run a half marathon tomorrow, probably going to get injured, or at least have quite a bit of pain, because what's not ready for it? The muscles aren't ready for it, the tendons aren't ready for it, the meniscus isn't ready for it, the cartilage isn't ready for it, your body just isn't ready to be able to do that. And if you're trying to get ready, you don't go start running every day. You run, a quarter mile. A couple days later, you run a half mile. A couple days later, you run 3/4 of a mile. Or however quickly your body can adapt. Some of that depends on age. Some of it depends on health. Some of it depends on if you've been doing exercise in other ways. Have you been doing walking? There's a number of different variabilities that go into that. How fast can you progress? Let's focus a little more on articular cartilage with that. So if somebody is not trained, what happens when they run, their cartilage shows changes from that training for longer than if somebody is trained. We all kind of know that. If you're a runner and I'm not, and you've been doing half marathons, if you go out and do a half marathon, then within a few days, the cartilage, your knees aren't as sore as if I've never done one and I haven't been running and I go do one, my knees are going to be more sore for longer. And we can, less extreme than a half marathon if somebody's not running. But if you haven't been running, you go do a mile, there's going to be a little bit of changes in the cartilage. If somebody's a runner, they can do a mile every day without probably any problem because it's not enough to really stimulate that cartilage. If somebody hasn't been running or they have arthritic changes, they're going to need a few days, if not a week or so, to recover from that. And we can actually see that on MRI, that trained versus untrained, the time that it takes that cartilage to recover. Let's think about an ankle sprain. So if I have a sprained ankle and it hurts to walk, I probably shouldn't run on it. It's not that running is a problem for people, but it's a problem when you have that injury, when you have that pathoanatomy. So at first you're going to baby it, hopefully do a little bit of physical therapist interventions, some mobilization, some isometrics, things that make it feel better, might be able to get you out there a little bit quicker. And we're going to slowly progress. It might be a little sore when you start running, so you may need a little bit more rest than you normally would. And eventually you're going to be able to get into a good training routine. Let's talk about deadlifting. If I want to lift 200 pounds from the ground, but I can only lift 100 pounds from the ground, if I go try 200 pounds, there's a chance I could get injured. especially if I'm trying to pull really hard or fast, there's a greater chance that I'm going to get injured if I'm going to do that. But if I can do 100 pounds, then maybe I do 95 pounds, 4 or 5 sets of 3. But then I'm going to wait until, for a few days to let my body recover until I can do that again. Let's talk specifically, so what has to get stronger here with the deadlift? The muscles throughout the legs, throughout the back, core muscles are going to have to get a little bit stronger to be able to do that. There's also discs that are involved there as well, that anytime we flex forward to be able to get that weight, even if we are trying to keep good form and trying not to let our back flex much, we're going to still be having some flexion, and all that muscular contraction with the weight, we're going to have a lot of compression and shear forces, and it's going to stress the disc. Now, our bodies are made to be stressed, so hopefully not a problem, but that we do need to consider that is probably the most limiting factor with lifting weight like that is the disc, because it's not going to get stronger like the muscles. As we look at these 3 examples with the bicep curl, muscles, see if I can do a little circle there, muscles respond the quickest. They're very vascular. You do a little weightlifting, your muscles get sore, you rest for a few days, they're not as sore, and then you go do it again, and they can respond. Tendon doesn't respond as well. That's why we have more problems with tendons, that we get tendinopathies, and they can be painful, and they don't recover as quickly. They're less vascular. And with running, cartilage is going to be probably the most limiting factor. It's not vascular. So if we're looking at running and how fast can we progress, sometimes people feel like they can do more, and then they get that injury because they can't progress like they thought they could. They felt a little bit better everywhere else, but then their knees or whatnot get sore. Sometimes it's a tendon, but typically it's not just muscular limitations there. Deadlift, the biggest limiting factor here is going to be the disc in all likelihood. Now, muscles may be what, not are limiting you from being able to get it up, but from being able to train and watching how much we're training, discs are an important aspect here. And so now we want to think about which of these structures get stronger and which of them just heal. So if we think about back here to bicep curls, muscles and tendons get stronger. They go at a little bit different rate, but they can get stronger. If we think about here with running, with cartilage, there's chondroblasts, and they can get stronger. It can heal and it can become a stronger cartilage. And so it does respond to that. It's slower, but it does respond. If we think about an ankle ligament, though, once it's sprained, it's never going to be quite as strong as it was. That doesn't mean that you can't do anything in the future, but mechanically we know it's not quite as strong even once it's healed. And that's similar to a disc. Discs heal, but they do not get stronger. And so as we're lifting, we can't say, well, if I do this enough, my disc will respond. Muscles will respond, but the disc won't. So now we want to think about what do we need to do to get ready to be able to do more of these things. If I want to be able to bicep curl 50 pounds, I'm not just going to do 10 pounds 10,000 times and expect to be able to get 50 pounds. I'm going to try to do a little bit more, rest, and then come back to it once I've recovered. Because we all know that no matter what tissue we're stressing, it doesn't get stronger while we're doing it. It gets stronger in the recovery process. And so, and each of them we're going to take a little bit longer or different time frames to heal, somewhat depending on the tissue. Sometimes it's dependent upon how healthy we are. What age are we? What kind of training have we done before? Genetic factors. There's a number of things. What else are we doing in life? How is our stress? How is our activity? How much will it take to recover? because nothing gets stronger while we're doing it. We all know that the more exercise we do, we don't just keep getting faster if we just keep running further. The longer we go in an exercise routine in one day, we're not just going to keep getting stronger. Eventually, we're going to fail. And so as we think about bicep curls, things will strengthen there. Running, some of those tissues and everything will strengthen. Deadlifts, some of it will strengthen, but the discs won't. So we want to think about recovery and healing. And so what we have to think about is, what else are we doing in daily life? If I am going to be, what would be something where I'd have to use my biceps quite a bit with? If I was going to be lifting something or climbing for whatever reason, I probably don't want to go do a bunch of bicep curls before, because then it's going to weaken me for when I'm going to have to be doing climbing if I'm going to be using my arms that day. Because at a certain point, that tendon is going to give out. It could rupture or it could tear a little bit. We don't know. If I'm using 10-pound bicep curls, and I'm able to do 20, but I want to get to 50, I can probably do quite a bit of 10 pounds. That's 50% of the max. We can do a lot of those. At what point will it take for my tendon to fail? I don't know that. There's all those factors, and it may not even happen that first day, but what if I don't let it rest and I do it again the second day, and I do it again the third day, and I do it again 7 straight days, 8 straight days, and then I build up, and then one night I don't sleep very well, and I don't have very good diet. At a certain point it says enough, and there's failure in it. So I want to be thinking about when I'm doing exercise, what and how does that relate with my activity level? It's easy to see that with just bicep curls, but what if I'm using my bicep in manual labor, in climbing, and a few things, if I'm also rowing, or that's a funky combination for somebody, but if they're doing a lot of those things, then all of a sudden maybe those bicep curls before got us to that failure limit a little bit quicker, because at a certain point, unless we give it time to recover, the body will fail. That's what overtraining is that tissues fail because we're not giving it time to recover. With the running, with the cartilage, if I'm going to keep going, once my knees start getting sore, I need to take some time off to let it recover before I go back to it. No program recommends 7 days a week of running without letting some recovery when you haven't been doing any running at all. So as we think about lifting, is what capacity does the disc have before it fails? It may not be the first day, especially if we're going lighter, we're keeping good form, but then what if we do it again the second day or the third day? And then what happens if we're also gardening that day, or if we're going to be sitting in a car for a long time, or if we're going to be doing some housework, we're helping somebody move? Did what we do with the deadlift, did it make it easier to fail later? Which we can sometimes see with people, like, I wasn't even doing anything and I got injured. I thought I could do this, this, and this. Why did this do it for me? Typically, it's the straw that broke the camel's back. It wasn't that one thing. It was everything leading up to it. And sometimes with the training, they used up some of their capacity. What they did is that they took away, because is it on the second one, the third one, the 10th one, the 10,000th one? Somewhere in there, was it the first day, second day, the body wasn't able to adapt. Oftentimes with lifting, it's going to be a disc issue, and it fails before it's able to adapt because we didn't give it time to rest. And so when we think about capacity, we want to think about the tissue's ability to be able to adapt, and at what point, what can they take at that given time? And there's a lot of factors. Again, age, health, sleep, diet, training, and everything in life. At what point is it going to fail? And if we don't let it recover, then eventually we're going to hit its capacity and there's going to be a failure.